Hello. We've made this film to aid your understanding about a special test that may be done after your breast cancer operation. Following surgery, several different tests are done on the tumour samples. Surgery removes the tumour, but as some cancer cells may remain in the body, hormone treatment, radiotherapy, and sometimes chemotherapy are used to reduce the risk of breast cancer re-emerging or recurring. These treatments are important as breast cancer recurrence affects longer-term survival. For example, if one particular test shows that the breast cancer tumour is estrogen receptor positive, it's likely that you'll be offered hormone therapy. Your breast cancer team may also want you to consider having a genomic or gene expression profiling test. Research done on thousands of patients with breast cancer shows that the results from these types of specialised tests are useful when deciding if chemotherapy might have a role in treating your cancer. You may have already been given leaflets to read that mention these tests. Chemotherapy is anti-cancer drug treatment that kills cancer cells. It's usually given as a course lasting from 4 to 6 months at the cancer centre via an infusion into a vein. This may take most of the day, as preparing and giving the drugs can require some time.
It has been really tough, actually.
Unfortunately, chemotherapy does cause certain side effects, as it destroys normal cells in the body as well as the cancer ones. Many patients go through treatments easily, but others find coping with the side effects such as nausea, hair loss and fatigue quite difficult. This is why we only want to give chemotherapy to those patients most likely to gain some value from it. Doctors consider a number of things when deciding whether or not to recommend chemotherapy. Some use a computer program called NHS Predict that calculates your overall chances of survival in the next 10 or 15 years. The program takes information about you and your tumour to predict the extra benefit you might gain from the surgery alone or from having hormones or chemotherapy as well. Remember that the point of any of these additional treatments is to reduce the risk of recurrence, as it is this that influences longer-term survival. Now, some patients have types of breast cancer that have such a low risk of recurring that chemotherapy would offer nothing useful, only the unwanted side effects. For other women who have larger tumours or higher risk breast cancers, the potential advantages are much more apparent. However, for some patients like you, when doctors look at all the information they have, the recurrence risk is less clear. And this is why a genomic or gene expression profiling test might be helpful. Genomic tests examine breast cancer tissue removed during a core biopsy or at your original operation, so you won't need to have any more surgery. The tumour samples are sent to specialist laboratories where certain genes inside the breast cancer cells that affect its behaviour, including how likely it is to grow and spread, are carefully examined. Several genomic tests are available. They're slightly different, but all look at the risks of cancer recurring and therefore help in predicting if chemotherapy is likely to lessen the risk. The Prosigna test is the one used at your hospital. This test looks at 50 different genes that are inside the breast cancer cells. Your doctor is sent a report showing the levels of activity of these genes. Results from the test provide the doctor with 3 important pieces of information. Firstly, the type of cancer and how it might behave. Next, the Prosigna score, which is a number between 0 to 100. Generally speaking, lower scores suggest that your cancer is less likely to re-emerge, whereas higher numbers indicate that the chance of recurrence is more likely. Finally, there is the risk category, which can be low, intermediate, or high risk of recurrence over the next 10 years.
As you can see,
Your doctor uses all this information, together with other things such as your age and the size and grade of your tumour, when deciding whether or not to recommend chemotherapy together with hormone treatment. Some doctors will use printouts with graphs to help when discussing these results with you in more detail.
and come back and we'll have another chat about it. Okay.
In summary, you have early stage breast cancer, which is estrogen receptor positive requiring hormone therapy. Doctors are not sure if chemotherapy is really necessary, so they already have or wish to send off a tissue sample from your tumour for specialised genomic testing. Unfortunately, no test can predict for certain if the breast cancer will re-emerge or not. However, we are seeing more and more research from thousands of patients showing that these genomic tests do provide a pretty good estimate of the recurrence risk. Whatever the result, it's important that you discuss options with your cancer team. They'll help you to weigh up the likely advantages of chemotherapy against its potential side effects and whether or not it has any useful role to play in your treatment.